Participation in clinical trials is very important. We have patients coming to us demanding that clinical trials be part of their care. It's because there is now a public understanding that this is the best care that can be provided for patients. And so we try to offer clinical trials for every patient. Sometimes the best treatment is standard of care, but sometimes the best treatment is a therapy that may push the envelope further and give patients a better outcome. And hopefully is something that we can offer to every single person that walks through the door. Now, ultimately, their choice may not to go on a clinical trial, but at least it's an option for them. Participation in a clinical trial is also important because it offers the patient to have new therapy that sometimes is not offered anywhere else. And sometimes patients are in situations where they have exhausted all of the standards, and that experimental treatment is something that gives them new hope that otherwise they would not have. There is data that indicates that the best patient outcome occurs in high-volume centers, such as ours. High-volume centers frequently provide experimental therapy or clinical trials for patients. Those go hand in hand. So we are committed to provide this access to patients so that they have the most choices, including clinical trials. Clinical trials also are highly regulated. And so we have to follow a very specific script in order to treat patients just so, which isn't to say that you wouldn't get good care outside of a clinical trial, but it's taken up several notches so that we can ensure the patients the safest possible quality of care when they receive treatment on a clinical trial.